Managing risk in a healthcare system is challenging. Reason being, hospital risk managers juggle many responsibilities to keep their organization safe. Specifically, they are responsible for identifying high-risk areas that can cause harm to patients, visitors, and employees, implementing programs to avert risk, and managing a robust reporting process for adverse events that do occur. Risk is an uncertain event or condition that, if it materializes, can have a positive or a negative effect on project success. Risk includes both threats and opportunities. Because hospitals have a lot to lose in terms of both reimbursements and reputation, accurate identification of adverse events is critical. Hospitals, and particularly risk managers, devote a lot of time and energy to determining whether an incident constitutes a reportable event. In fact, all incidents are evaluated and vetted by multiple departments to determine whether the event is indeed reportable. Risk management is a systematic approach to identifying, analyzing, and responding to risk, maximizing the probability and consequences of positive events, minimizing the probability of consequences of adverse events. A hospital risk manager, also known as a risk management director, proactively works to prevent situations that can result in losses or liability. In a hospital setting, situations can include patient privacy breaches, diagnostic, surgical or medication errors, and hazardous conditions. A risk manager oversees the entire risk management program and helps develop systems and processes to improve the monitoring and control of risk. As part of their responsibilities, he or she reviews changes in legislation and regulation. The hospital may ask them to perform these and other duties alone or with a team of risk management specialists. If they have a team, they usually hire new staff, manages the work schedule, assigns projects, evaluates work performance, and issues benefits of disciplinary action. With increasing federal oversight of hospital processes and outcomes, risk managers have an impressive workload. To perform all their responsibilities, risk managers need to constantly prioritize their work, which involves assessing the risk of completing one task over another. One responsibility of a risk manager is to identify risks to the hospitals. They do this by reviewing past incidents and claims, hospital loss, liability reports, local and national hospital-related incidents, risk data, and statistics. The risk manager might also monitor the actions of hospital staff or their work environments to check for issues of compliance with existing policies and procedures, or ask hospital department managers to provide risk assessments about staff, patient, or visitor safety. To maintain a low-risk environment, risk managers standardize appropriate practices across the organization. Hardwiring these practices into employees' workflow requires managers to educate providers and staff and establish redundancies that ensure certain steps are completed, including alerts or other messages and electronic health records that remind staff of appropriate practices can help make processes consistent. While risk managers have the main responsibility to identify risk, it would be difficult for them to detect every single risk throughout an entire organization. Instead, providers, staff members, and leaders should be able and encouraged to report observed risks. Patient safety is everyone's responsibility.